I'm going to start broadcast. Here we go. All right. Welcome everyone to the Green Nurse Monthly Clinical Conversations webcast, where we bring hope and inspiration for growth and healing. The Green Nurse podcast, Clinical Conversations, came about when Nurse Elizabeth and I merged our companies, Holistic Caring and the Green Nurse, alongside of Bloom Hemp, creating Holistic Caring Network. We are in our 8th year of podcasting, our 3rd year of clinical conversations, where we explore all aspects of how to optimize cannabis as a medicine. We have a saying: people are making great medicines, people are selling these medicines, yet no one is truly interpreting how to use cannabis as a medicine. And that's what we do. So cannabis nursing has been recognized as a specialty, and nurses are truly making an impact on advocating for the safe therapeutic use of cannabis. And we're going to get started. We're going to pull up our slides. We have a full deck today. So we added some new slides, added some new research, really exciting. Today's clinical conversation is the presentation is on the therapeutic use of cannabinoids for breast cancer care, with research and starting protocols for different breast cancer types. And Elizabeth just pulled those slides up there. There we go. And we're going to get started. We do have a couple of polls. We will be taking questions at the end, and we're just going to continue on. All right. So this webinar and clinical conversation session is proudly sponsored by the Kenigma and Bloom Hemp CBD. And you can scan those QR codes if you'd like. Ask the Green Nurse at the Kenigma brings evidence-based cannabis nursing insights, empowering patients and professionals alike to navigate plant medicine with clarity, compassion, and credibility. And then Bloom Hemp at the Kenigma Marketplace showcases premium hemp-based wellness solutions and products, connecting patients to trusted full-spectrum solutions that support balance, healing, and everyday vitality. And we'll be going over more of this at the end of the presentation. Okay, so introducing the therapeutic use of cannabis and hemp CBD. So I'm just going to tell you a little bit about my background and how I got started in cannabis as medicine. And this lovely lady here is Marianne, and she was the first person who introduced me to medical cannabis in 2012 during a time when I was sick and suffering and on over 18 pharmaceuticals. So she was a 70-year-old nurse, retired friend of mine who visited me when conventional care had failed me and I was struggling. She shared her wisdom and cannabis harvest with me, offering me comfort and relief. She came to my house with a basket of goodies, things that she had harvested from her garden. And she had, a couple of joints and topicals and edibles, and she pretty much told me that I needed to get with the program. Get with the program, Sherry. Cannabis has been around, for a long, long time. She shared her wisdom with me and her harvest, offering me comfort and relief when I needed it the most. She disclosed to me that she had been using cannabis since she was 17 and was not on any ongoing pharmaceuticals. That's 53 years of using cannabis every day. And I had to kind of take a look at that. She also revealed to me that her father was a pharmacist and stocked cannabis in his pharmacy before 1937. And this is when Prohibition hit with the Marijuana Tax Act. So moving right along, my name is Nurse Sherry Mack. I've been a nurse for 37 years this year, a very long time, 25 plus years in conventional care system at the big teaching hospitals in Boston, doing a lot of different things, 20 years in holistic nursing, 10 plus years in the plant medicine arena, including cannabis and psychedelics. And I'm grateful to be Chief Nursing Officer and co-founder of Holistic Caring and the Green Nurse, Vice President of Nursing at Bloom Hemp CBD, founder and host of the Green Nurse podcast. And I am involved with a lot of different cannabis organizations and networks and in groups and organizations, and contributing author to Clark's Cannabis, a Handbook for Nurses.
And I am Elizabeth Mack, and I am a nurse 1 year longer. Spent my first 10 years in hospitals, my next 20 in insurance companies, in operations and sales once I got my MBA in healthcare administration. And I fell into cannabis therapeutics. Quite literally, I crashed my bicycle, went out on leave to have surgery. And when I was at my chiropractor's office, I was introduced to CBD, and I started to use it topically and also internally with CBD tinctures and extracts. And I started to heal not only from that bicycle accident, but from many other things that were troubling me. And I said, gosh, if I can help myself, I've got to help heal others. And that's when I decided to get into this realm of nursing and hunt out my own shingle with Holistic Caring until I merged with Sherry and we formed Holistic Caring and the Green Nurse along with Bloom Hemp CBD. So I am past treasurer of American Cannabis Nursing Association, director of health and treasurer for Los Angeles Normal, and a board of director for the Coachella Valley Cannabis Alliance Network. So we stay very busy. And I too authored a book, Cannabis for Health, Become a Coach. Very proud of that. But, you know, one of the things that we want to shed light on is that there is a cannabis nursing specialty practice now. Nurses are the only licensed medical professionals publicly supporting cannabis, and the ANA deemed cannabis nursing a specialty back in September of 2023, and we are still moving forward. So it's 20 years that the ANA has supported cannabis nursing, and we are Holistic Caring. So a quick disclaimer. This content is not to be substituted as professional medical advice, nor has it been approved by the FDA. Also, cannabis remains a Schedule I drug, but is currently legal in 40 US states for medical use, 24 for adult use, and we do hope to see it rescheduled very soon and to bring you hope through the content in this presentation.
Okay, so attention please, our first poll. We want to know how you heard about this webinar. So I'm going to put the question up. How did you hear about us? Holistic Caring and the Green Nurse, newsletter, Bloom Hemp CBD, the Canigma, or social media. So we want to know how you heard about this presentation today. So if you could answer the poll, that would be really helpful. Okay, I will publish the results.
100%.
Yeah, we're almost there.
Just about.
Almost there, percentage. We got 10 out of 15 of you actually let us know. Thank you. So most people heard us from social media or Holistic Caring and the Green Nurse. So I'll publish that result. And then we also have one other question too. We want to know who we're speaking with today. Are you a patient? Are you a provider? Are you a family member or a friend of a patient? And we wanted to kind of know who we're speaking with today. Okay, and I will actually, we got about 80% of people answered. The majority of people are patients, some providers, and some family members. So I'm going to publish that result as well. Okay.
Good cross-section of people here today.
All right, and let's continue on.
Righty.
Okay, so we're just going to discuss really briefly what breast cancer is. I don't want to get into too much detail, but breast cancer is a malignant tumor that begins in the cells of the breast, typically the ducts or the lobules. There's many different types of breast cancer, but the hallmark of cancer cells is that they grow uncontrollably, so the uncontrolled growth, resistance to apoptosis, which is programmed cell death, which we're going to talk about in detail a lot during this presentation, and the potential to invade and metastasize to other cells. So there are many risk factors: genetic mutation, BRCA1, BRCA2 gene, family history, hormonal influences, lifestyle factors, obesity, poor nutrition, alcohol consumption, and stress, and then the endocannabinoid deficiency, which we're also going to talk about in detail as well.
Absolutely. So moving forward, we're going to talk about the diagnostic and treatment approaches. So when we're trying to pick up cancer, most of the time with breast cancer, we are exploring mammograms, and we're supposed to get one every year. And if anything looks suspicious, then a biopsy is done. And if anything, it is going to proceed from there. Hormone receptor testing is done to know really how to dial in the treatment for conventional care. The different subtypes of breast cancer include estrogen receptor positive, hormone progesterone receptor positive, and HER2 positive. There is also something called triple negative breast cancer, where there are no receptor types expressed, which is a much more aggressive type because there are less targets. So conventional surgery, conventional modalities include surgery, radiation therapy, chemotherapy, hormone blocking therapy, and targeted biological therapies along with immunotherapy. And many people are mixing and matching all of these at some point in their journey. And we intersect with people as they go through this, trying to help them maximize their therapies along with cannabinoids.
Okay, we have to talk about cancer treatment side effects. There are a whole host of them that we see with a lot of patients that we take care of: nausea and vomiting, fatigue and insomnia, anxiety and coping issues, depression and apathy, appetite and weight loss, hair loss, neuropathy, body aches, bone pain, lymphedema, deep vein thrombosis, graft versus host disease for those that may have a bone marrow transplant, mucositis, which is inflammation of the mouth, early menopause, skin rashes, motivation loss, and failure to thrive. These are cancer treatment side effects that we see across the board. And many people cycle through these various different side effects at different times during the treatments, and they need real relief. And this is where cannabinoids can be helpful.
So many people come to us and say, hey, I've heard about using cannabis for cancer. How does that work? They want to know if it's curative. And we have to say, from preclinical research, there are proof that cannabis can help shrink cancer cells, restrict nutrients from them, and to stop it from spreading. But that, again, is in preclinical stages. On the palliative side, we know that it can help manage symptoms, helping people to eat, sleep, reduce pain, anxiety, nausea, vomiting, and neuropathies, and helping manage the symptoms a lot better. So the research is evolving, but cannabinoids can reduce symptoms associated with cancer and its treatment. And one of my favorite books is Cannabis for the Treatment of Cancer by Justin Kander. He's a researcher and cannabis oil producer. And some of his statements from the book is, when cancer cells are exposed to cannabis, they experience apoptosis, or programmed cell death. The cancer cells die, healthy tissues remain. Phytocannabinoids appear to be a biologically ideal solution to cancer. In cell and animal models, cannabinoids exert anti-cancer activity against most cancers, and their generalized therapeutic effects indicate that they may fight all cancers at some levels. And this will help you understand this next slide.
This next slide is one of my favorite slides. So the cancer-killing actions of cannabinoids. So cannabinoids from cannabis and hemp are pleiotropic workhorses. That's a big word. So pleiotropic means that it can be used on multiple symptoms, conditions, and systems all at the same time. So it can palliate multiple symptoms and conditions at the same time. So the cancer-killing actions of cannabinoids, we discussed apoptosis. This is a natural process of the cell cycle where cells self-destruct when they're damaged, and this is called cell suicide. So cannabinoids can induce apoptosis of the cancer cell while leaving the healthy cell alone. Anti-angiogenesis. This inhibits new blood vessel formation and starves tumors. Anti-proliferative, preventing cells, especially cancer cells, from growing, multiplying, and spreading. And then anti-metastatic. Cannabinoids can block cancer from spreading to other parts of the body.
So one of the most groundbreaking meta-analysis reviewed over 10,000 studies with medical cannabis and associations with cancer. And this was done this spring, published in Frontiers in Oncology. And it was conducted by the Cancer Playbook, powered by Whole Health Oncology Institute. And their findings included that 70% of the studies showed pro-cannabis outcomes, even after adjusting for outliers. 30% of the studies showed unclear results, which may or may not be favorable for cannabis. And most showed that there was a decrease in pain. In many cases, cannabis outperformed opioids. A decrease in chemotherapy side effects, especially for nausea and appetite loss. A decrease in inflammation, which is a key player in cancer progression. And an increase in tumor shrinkage and cancer cell death, especially in lab and animal studies. And we're awaiting more human clinical trials as soon as this is rescheduled, but we're seeing much more on an observational basis with good results.
Okay, one of my favorite slides, we use Cannakeys. This is the breast cancer research dashboard from Cannakeys, and this is where we get a lot of our research from when we're educating patients and professionals that we're working with and our coaching and consulting. So you can see there's over 137 total studies You know, the overall positive results, gosh, is at 93% with the positive clinical results of 100%. So preclinical trials show complex interactions by the components of the endocannabinoid system and their ability to therapeutically influence breast cancer through several different mechanisms. And this is just a repeat of the other slide, but I'm just going to say it again. By blocking cancer cell progression, inducing apoptosis, inhibiting cancer cell migration, modulating genetic expression, and inhibiting cancer cell blood supplies, the angiogenesis.
And going back to real world evidence, a cola cannabis survey conducted by breastcancer.org surveyed the characteristics of cannabis use by breast cancer patients in America. And out of 612 participants in the study, 42% reported using cannabis for the relief of their symptoms, for pain, insomnia, anxiety, stress, and nausea and vomiting. And appetite, I'm sure, is also included because it really does help for that. 49% of consumers believed that cannabis would treat the cancer itself. 79% used it during collective treatments, including chemotherapies, radiation, and surgery. And only 39% discussed cannabis use with any of their physicians. And we implore all of you to be forthcoming with your team because it does matter on how you use these together.
Cannabidiol as a novel inhibitor of ID1 gene expression in aggressive breast cancer cells. So research as far back as 2007 has shown that breast cancer is highly associated with ID1, a gene that's linked to increased tumor growth. So CBD and CBDA, which is the acidic version of CBD from the raw plant, can actually downregulate ID1, suggesting potential anti-neoplastic activity against breast cancer and its spread.
Okay, so now we're going to go through some of the protocols that we have gleaned from the Cancer and Cannabis Protocol Connection book that we are going to show you very soon. But first up is triple-negative breast cancer, and it is very aggressive and difficult to treat. Cannabinoids, especially those targeting CB2 receptors, show promise in fighting triple-negative breast cancer in preclinical models. And you can see here the receptors on estrogen, progesterone, HER2. Well, in triple-negative, those are absent. So it's 10 to 20% of cancers. It lacks those receptors, so there's no targets for conventional care. But CB2 expression is going to be prevalent because CB2 is something that something that we can target with cannabinoids. So cannabinoids, CBD, we're going to use full spectrum of 100 to 300 milligrams per day. CBG, full spectrum, 100 to 300 milligrams per day. And high THC, full extract cannabis oil, or what we call FECO oil, titrating to the highest tolerable dose, which is going to differ for each person. Beta-caryophyllene is a terpene that also directly targets the CB2 receptors, which you'll hear a lot about today.
Yeah, we're going to get into beta-caryophyllene a lot more in this presentation and some upcoming slides. So now we're going to talk about HER2-positive breast cancer. So HER2-positive tumors respond to cannabinoid therapies that engage CB2 receptors. Whole plant cannabis demonstrates better outcomes via the entourage effect. So the entourage effect states that the whole of the plant is greater than its individual parts. So HER2 tumors have a very aggressive behavior. They grow very, very rapidly. Dr. Cristina Sanchez found that THC and CB2 agonists, again, CB2 is a receptor, inhibit HER2 tumor growth. So anything that can plug in to CB2 initiate a biological response can have an impact on HER2 cancer cells. Botanical extracts, full extract cannabis oil outperform synthetic THC in the research. So the protocol for treating HER2 is CBD full spectrum, 100 to 300 milligrams a day, CBG full spectrum, 100 to 200 milligrams a day, CBDA, this is the acidic version of the raw plant of CBD, 50 to 150 milligrams a day, and then high THC full extract cannabis oil, titrating to the highest tolerable dose, again, which is different for everyone, and then beta-caryophyllene, which is a terpene, also target CB2 receptors. And again, we're going to have a beautiful slide all about beta-caryophyllene coming up.
So estrogen and progesterone positive. So hormone receptor status is key to choosing effective treatments and predicting outcomes. For ER and PR positive cancers, hormone blocking therapies are often most effective, improving survival and quality of life. 70 to 80% of breast cancers are estrogen receptor positive. 65% are also progesterone receptor positive. Only 1.5% are ER negative, PR positive, making them extremely rare. So there is controversy of whether or not THC might worsen outcomes. And if you are a PubMed nerd like us, you might have seen some studies that say that THC can worsen breast cancer outcomes. And what we're finding is that there's no clinical evidence that THC or RSO from whole plant medicine will make any type of breast cancer better or worse in humans, according to the Cannabis Cancer Connection book. Synthetic THC or Marinol or some of the test synthetics that they have in the lab that they're studying in lab cultures show that cannabis is ineffective if there are no CB1 and CB2 receptors from breast cancer cells and may even cause adverse outcomes. But the whole plant medicine from fully extracted cannabis oil is effective, and it's not going to worsen outcomes like perhaps the synthetic does.
And many patients that are consuming cannabis aren't using synthetics to begin with. No one's using synthetics at all. So now we're going to talk a little bit about estrogen positive breast cancer protocol. So THC may exert anti-estrogenic and anti-tumor effects in hormone-driven breast cancer. So estrogen acts on two different receptors. We have ERA, which could promote growth, and ERB, which could inhibit growth. THC can downregulate ERA and upregulate ERB. So this may limit the growth of cancer cells at the ERA receptor and inhibit the growth of cancer cells at the ERB. So this suggests the potential for THC to slow cancer progression in estrogen receptor positive tumors. So the protocol for treating hormone positive is a little bit different, focusing more on CBD and the minor cannabinoids. So CBD 300 to 400 milligrams a day of full spectrum, CBG 100 to 150 milligrams a day of full spectrum. Again, the CBDA, which is the raw part of the plant, 100 to 150 milligrams a day. THCA, again, is the raw part of the plant, 100 to 150 milligrams a day. And THC in and of itself, a little bit less, 25 to 40 milligrams a day, less THC, more of the whole plant. And this is taken from the Cannabis Cancer Connection in the protocols. And then we're going to focus a little bit more on CBD because there is a lot of research around how CBD and estrogen positive breast cancer, and the key insights from these 5 different studies going back as far as 2006 showed that CBD and CBG were more effective than THC in inducing anti-tumor effects at the MCF7 estrogen positive breast cancer cells, setting a precedent for cannabinoid-based oncology. Back in 2011, Harvard Medical School ALT study found that CBD inhibited both estrogen positive and estrogen negative breast cancer cell survival, triggering apoptosis in a dose-dependent manner. In 2018, Egyptian researchers identified multiple mechanisms through which CBD induces apoptosis, further supporting its anti-neoplastic activity. In 2019, Austrian research concluded that cannabinoids, while commonly used for symptom management, may also slow tumor progression, particularly in early stages of estrogen receptor positive cancers. And finally, in 2021, research from Portugal confirmed that CBD is the most effective cannabinoid for estrogen positive breast cancer, with THC playing a lesser role.
So another area of controversy is whether or not you can use cannabinoids, especially CBD, with tamoxifen. And we advise a careful approach. Tamoxifen is a key therapy for estrogen-positive breast cancer, and it works by blocking estrogen receptors, but it requires conversion by enzymes in the liver to create the active form endoxifen. Cannabinoids like THC and CBD may enhance or inhibit tamoxifen because cannabinoids inhibit the liver enzymes that reduce the conversion to endoxifen. This could limit the effectiveness of tamoxifen estrogen blocking activity. However, cannabinoids may also enhance the cytotoxic activity of tamoxifen, potentially enhancing the efficacy in killing cancer cells. So for those wishing to use cannabis as a treatment, it is suggested for postmenopausal women to use aromatase inhibitors instead of tamoxifen because they don't rely on the CYP enzyme conversion that tamoxifen does. So the takeaway, if you're using tamoxifen to kill cancer cells, go ahead and combine it with cannabis. If you're using it to block estrogen, use with caution and monitor. And again, we're generally talking about CBD, not THC.
So cannabinoids in immunotherapy. So there's many, many different types of immunotherapy. Timing matters, and we need to decrease high doses of cannabis around immunotherapy days. So when you think about what does immunotherapy do, it helps the immune system recognize and attack cancer more effectively, right? The side effects can be prolific: fatigue, fever, skin reactions, joint pain, autoimmune reactions, which cannabinoids can be very helpful. High dose THC or CBD may suppress immune response as an anti-inflammatory. So high doses of cannabinoids may actually interfere with antibody production critical to treatment. So what we're doing is we're causing inflammation in the body, revving up the body, creating these antibodies to help fight the cancer cells. And we want the immunotherapy to work. So low doses of cannabinoids to manage symptoms or side effects, but higher doses on immunotherapy days are discouraged. So we teach people how to have two different types of care plans, those for treatment days and those for non-treatment days. So high dose full extract cannabis oil or the Rick Simpson oil fasting is suggested just for those days that you're having immunotherapy, using the minimum effective dose of cannabinoids to treat symptoms such as pain, sleep, anxiety, nausea, and appetite. So if you're going to be combining the both, it's good to work with the clinician because clinicians will help you to be able to dial it in and to have the two different types of care plans, those days that you are having immunotherapy versus those days that you're not. Another one of my favorite slides is from Kiskovka et al. In 2019, and this just shows the difference of the anti-tumor effects and the psychotropic effects of the various cannabinoids, particularly CBD and THC. So the anti-tumor effects you see with CBD: decreased proliferation, increased cell death with THC, increased cell cycle arrest with both CBD and THC, decreased inflammation with CBD and THC, decreased tumor vascularization at CBD. And this is, think about the immune system being affected by this. And then the psychotropic effects, think about cannabinoids interacting with the brain to decrease neuropathic pain. This is THC, decreasing nausea, THC, and decreasing anorexia and helping people to eat, more along the lines of using THC for this.
And the Cannabis and Cancer Connection book, this is something that I advise all patients and caregivers and providers to purchase. It is by a good friend of ours, Joe Goldstritch, and addressing the controversy about estrogen-driven cancers. After reviewing all of the research, I have concluded that the claim that THC stimulates the growth of human estrogen-positive breast cancer cells is not supported by published peer-reviewed scientific literature. However, CBD appears to be the most potent and beneficial cannabinoid above all others for healing breast cancer.
Cannabis in cancer aftercare, the research gap. So there are currently no formal guidelines for cannabis use after completing cancer treatments, but we do recommend continuing. We have taken care of over 6,000 patients in the past 10 years between us, and many patients do use cannabis for ongoing symptom relief. A lot of these medications and treatments can cause side effects, ongoing pain. People have insomnia, anxiety, neuropathies, and cannabinoids can be very beneficial. However, there is no clinical evidence for preventing recurrence or sustaining cancer remission, but there is an urgent need for evidence-based integrative and holistic survivorship planning for whole person care. So cannabinoids may be used as a wellness tool with lifestyle as medicine post-cancer for residual symptoms and to promote the relaxation response for ongoing healing. And many of the patients that we work with do continue on just taking half the dose, and we're going to get into that in another slide.
Mm-hmm. And this is a very important slide. Scan this with your camera right now and go and get this guide from cancer.gov. The National Cancer Institute publishes all of the peer-reviewed literature that you could possibly ever want to know on their site. And this page takes you to the professional version of this. There's also a patient version that might be a little bit more understandable, but they are really putting together a lot of research and collating all of the cannabinoid and cancer research for everybody to benefit from, and it's all free at cancer.gov. So now we're going to shift from the research to the botanical side of this marvelous healing plant. We've covered a lot of the science, and now we're going to get into more of the practicalities. So cannabis and hemp are some of the richest plants on earth, with over 1,500 natural compounds, and the medicine is in the trichomes, and you'll see the purple sticky stalk here in the middle. That is containing the little resinous glands that are influenced by strain, soil, climate, and cultivation techniques, but they are rich in cannabinoids, terpenes, flavonoids, canaflavins, essential fatty acids, and all of the good stuff that comprises cannabis therapeutics. Pleiotropic, as Sherry mentioned earlier, is a very special word because when people ask why cannabis works on so many things all at the same time, when you get it into the systemic circulation, it truly can scrub the body and look for the receptors that are actually open to plug in and to find balance or homeostasis. And that is what the endocannabinoid system does, which we're going to get to. And the phytocannabinoids from this plant mimic the endocannabinoids to fill in and correct the cell signaling. We should be making these endocannabinoids on demand in response to stress, but when we get sick, we often don't.
So cannabinoids come in three types. People will say, well, what's a cannabinoid? A cannabinoid is a molecule that interacts with the endocannabinoid system. So endocannabinoids we make internally, example is anandamide and 2-AG. Phytocannabinoids is made externally by the cannabis and the hemp plant. Two examples is the THC and the CBD plus the minor cannabinoids. And then synthetic cannabinoids are made by the pharmaceutical company. So THC and CBD are the two most abundant phytocannabinoids that mimic our own endocannabinoids to activate the endocannabinoid system. And as you can see over to the right, the THC molecule and the anandamide molecule look pretty much the same, and they plug into that nerve receptor to initiate a biological system to tell the body to either do something or not just do something. Generally, we're running hot, and it helps to dial down things. So phytocannabinoids from the cannabis and hemp plant are 10 times stronger than the endocannabinoids that we make, lasting for several hours as opposed to the microseconds of the life of anandamide and 2-AG. So we're making internal endogenous cannabinoids all the time, going on and off to regulate all of our different systems at the exact same time. So we don't need a lot of THC to do that, a little bit. So this slide here is my favorite slide. It kind of helps to explain the endocannabinoid system. I call this the green nurse umbrella, and to explain the endocannabinoid system as the master regulatory system. The umbrella demonstrates the interconnectedness of all of our 11 body systems and all of our neurotransmitter signaling systems. Those are spokes of the umbrella are our different organ systems, our immune system. The different color fabric pieces are the neurotransmitter signaling systems, and they're the ones that are giving messages to tell the different parts of the body to either do this, stop doing this, and it's all happening at the same time. The endocannabinoid system blankets on top of our entire umbrella because we have cannabinoid receptors that sit on all of the cell surfaces of all of our 11 organ systems and at the neurotransmitter signaling junction site. So the endocannabinoid system is like a switchboard sitting on top of every other system, listening, sensing, and steering our bodies back into balance. So just imagine we are made up of 30 trillion cells broken down into 11 organ systems in our immune system, regulated by the master regulatory system called the endocannabinoid system.
Okay, so now we're going to zoom in a little bit and talk about this very special endocannabinoid system and retrograde signaling, which I call feedback pharmacology. So we have CB1 receptors, generally in the brain and the central nervous system and the central channel. And then the CB2 receptors are largely in the immune system based in our gut, but generally you have these receptors on every one of your cell membranes throughout the entire body. It just depends on concentration. And then you have anandamide and 2,8-G, which are the endocannabinoids, and they float backwards. That's that retrograde signaling. It's almost as if there's a football coach calling plays and sending in players to plug into that receptor so that we can downshift the body, generally to decrease the stress of what we have going on. And so the three components are the receptors, the endocannabinoids, and the enzymes that create these and dissipate them. And like Sherry said, it's something that is happening in microseconds, as opposed to the phytocannabinoids, which also plug in. THC and CBD can plug into these in different ways and perform the same reaction, so that if we're running deficient, we can substitute. And that is what happens. So the endocannabinoid system deficiency means that the three components of our ECS are not working well. The messages don't get relayed. The body malfunctions, hindering our ability to adapt to outside and internal stressors, and we get sick. We have chronic conditions. The number one cause of these is aging. So when we're about 25, this system is at its most fluent, but as we age, it starts to trail off and we become less efficient at repair. Genetics can also play a part, which is some of the reasons why there are very sick children. Their endocannabinoid system is not working from the get-go. Then lifestyle, poor diet, lack of exercise, obesity, chronic stress, sleep, poor sleep, insomnia, smoking, drinking too much, polypharmacy, using too many pharmaceuticals that then void the body of nutrients, and then diminished social interactions, lack of love, touch, and laughter. All of that contributes. So if we reverse all of these, you take good care of yourself, you connect, you laugh, it really is some of the best medicine. So, and lastly here on the pharmacological actions of non-psychotropic phytocannabinoids, look at just some of the pleiotropic effects of CBD. Anxiolytic, lowering anxiety, neuroprotective, vasorelaxant, anti-proliferative, anti-cancer, anti-diabetic, antibacterial, anti-inflammatory, bone stimulant, etc. Over 40,000 studies show that CBD and the minor cannabinoids can be used to modulate disease, and this doesn't even include THC, which everybody thinks is the best, but it really does show that we need the synergy of all of these compounds.
Oh, so we're back to our friendly Canna-Keys slide. This is the Tetra THC research dashboard, and look at all those studies, 2,286 studies. When people say there aren't enough studies, I say, yes, there are, there's plenty. THC is a multi-targeted molecule that binds directly with those CB1 and CB2 receptors that we just saw on the slide, supplementing our endocannabinoid system to restore balance. Wanted to bring up that back in 1985, the FDA did approve Marinol, which is synthetic THC, for the treatment of nausea and vomiting associated with cancer chemotherapy. We don't see it being used a lot today because a lot of patients don't like it because it causes dysphoria. There is clinical evidence for using THC for all of these conditions, and it includes cancers as well as a lot of the different side effects and symptomology that patients are having, and they're all listed here. And what's beautiful about this is these are actually research studies that open up. This is taken directly from Canna-Keys, and this is done on humans. So this is clinical evidence for using THC for all of these different conditions.
Yeah. And CBD on the other side is a multi-target molecule that modulates CB1 and CB2. Doesn't necessarily plug in like THC does specifically, but it's also active at about 70 other receptors in the body, including our GABA, serotonin, dopamine, TRP receptors, and it buffers our complex biological changes in the body, mind, and emotions. Epidiolex is a purified form of CBD that was approved by the FDA in 2018 for rare pediatric seizure disorders. And you can see here that there are about 2,500 studies on just cannabidiol, and the clinical evidence, again, human clinical trials where CBD is proven to have efficacy, and of course, cancer and many of the symptoms and side effects that you're struggling with can be mitigated including breast cancer.
Okay, eat, sleep, relax, forget, protect. We're going to talk a little bit more about the endocannabinoid system. And this is a phrase that was coined by endocannabinoid system researcher Vincent DiMarzo in 1998, and the amazing book by Dr. Michelle Sexton in 2023. Dr. DiMarzo speculated that the endocannabinoids function as stress recovery factors that are survival based. Our autonomic nervous system, and this is the nervous system that does things automatically without you even knowing about it, is modulated by the endocannabinoids seeking to balance all the physiological systems in our body. Go back to the umbrella. We want to keep our umbrella going up and down nicely. So the concept of eat, sleep, relax, meaning for health, because the endocannabinoid system regulates the physiological processes such as mood, memory, appetite, pain, and sleep. So if the endocannabinoid system is working well, we feel good. If it's not, we don't. And we're going to get into each of these in detail. So think of eating, appetite, and metabolism. The endocannabinoid system signals everything in the gastrointestinal tract: motility, acid fluid balance, dilation of blood vessels, nerve conduction, muscle contraction, and alerting us when we need to take in food. So a lot of patients that have breast cancer may need help with appetite stimulation or help with their GI health and gut microbiome. And so THC and CBG can be beneficial for appetite stimulation, for gut microbiome health, CBD and CBG, and helpful cannabinoids for the gut for specific symptoms. Patients that are experiencing nausea, we teach them about THC inhalation. One puff is enough to downshift the stress response to allow them to get in some of the oils that can help manage the other symptoms that they're having. THC oils can slow down motility for those that are experiencing diarrhea. CBD oils can help with constipation. Again, patients that are looking to lose weight or have diabetes, THCV and CBD oils can be beneficial. And then again, those that have gastroesophageal reflux disease, CBD and CBG oils have been very beneficial. Sleep, resting and restoring. So the endocannabinoid system helps regulate our circadian rhythm. This is our body's internal clock that governs physical, mental, and behavioral patterns over a 24-hour cycle. And this includes sleep-wake cycles. So think about, what is the cornerstone of a good night's sleep, right? The ease of falling asleep and staying asleep, deep restorative sleep and REM dreaming, waking up feeling refreshed with no residual drowsiness in the morning, right? And I want people to understand that using plant phytocannabinoids for sleep is very different than pharmaceuticals. People are so used to taking something right before they go to bed. But when we're working with the endocannabinoid system, we want to downshift stress in the daytime. We want to modulate the endocannabinoid system in the daytime using CBD, CBG, THCV in the morning to promote daytime energy, promoting the relaxation response, helping people to be productive. And then we fold in some of the THC, CBD, CBG, CBN in various ratios in the evening. We teach patients how to stack multiple cannabinoids for various routes and for different effects. So if someone has just issues with just relaxing at night, I'm just going to give an example. Someone might want to put topicals all over the body that promotes the relaxation response. It's a good thing to do in the evening times to soothe the body. You know, difficulty falling asleep, you want something that's faster onset. So inhalation and tinctures are generally best because those happen very quickly. If you have difficulty staying asleep, you might want something that's more longer acting. So edibles, soft gels, and capsules might be beneficial. Oftentimes patients that we work with have issues with all of these. So we teach them how to stack appropriately in the daytime and evening so they can get a good night's sleep. And finally, modulating fear and anxiety. This is relaxation, right? The endocannabinoid system signals both the fight or flight response and the relaxation response. We cannot control the fight or flight response, but we can control the relaxation response. It requires conscious awareness and practice. Lifestyle is medicine. Stress brings people to cannabis. Anxiety is actually the #2 reason why people come to cannabis, pain being #1. So the studies and research has substantiated that high CBD, low THC products are the safest and most tolerable options for all anxiety types. Full spectrum CBD products are the best starting point. Adding in 1 to 2 milligrams of THC is tolerated. And then again, there's other cannabinoids that can be used for relaxation as well. A combination of CBD, CBDA, CBG, CBGA can all reduce anxiety without cognitive or sedating effects. CBD can also counteract THC-induced anxiety. So for people that are new using THC, we always recommend having CBD on board. And there's new clinical trials that show that CBG can actually help reduce anxiety. CBG also helps the body, the endocannabinoid system, with its own anandamide production. And this is our own bliss-like molecule that mimics the THC molecule. So THC is effective at low doses, 2 milligrams, 2.5 milligrams, but at higher doses, especially in sensitive individuals or people that are new to cannabis, it could get into trouble. So consumers, again, do best overall with more CBD than THC for anxiety.
And shifting over to forgetting. This is having to do with our learning and memory centers and our CB1 receptors. So the ECS supports this by activating CB1 in the hippocampus and the amygdala, helping us to learn, store, recall, and modify our experiences. The most helpful cannabinoids for activating CB1 is THC. It mimics anandamide that you saw on the other slide. But remember, it's biphasic. So low to moderate THC can help reduce and soften pain, emotional pain and physical pain, helping you forget some of your troubles. And that's why people like THC, because it can disconnect some of that worry and pain. So low THC also boosts memory and cognition at CB1, but high THC does the opposite, causing that stoned, forgetful feeling. So if that happens, reduce the milligrams of THC and add CBD to balance it out. THC also helps us forget or trim old memories, and generally happens in our brain during sleep, letting go of the old and making room for new. And THC can inhibit acetylcholinesterase, allowing for more acetylcholine, which is our memory-preserving neurotransmitter. And we run short of that as we age, and anybody with dementia and that sort of thing. THC also stimulates BDNF, our brain-derived neurotropic factor, which enhances neuroplasticity, helping us learn new things. So balancing THC with CBD and the minor cannabinoids help to maximize the benefits and minimize the risks. And shifting over to CB2, this is our protect function. Think of the immune system and the shield. The endocannabinoid system regulates anything that is not me or anything that's foreign across the body. CB2 receptors are highly expressed on 6 cells. So anybody with cancerous cells are going to have an overexpression of CB2 receptors, looking for those endocannabinoids to plug in to right the ship, and it's always sensing what is going on and looking for balance. But endocannabinoid system deficiencies cause errors in the communication system, and that's where we fall short and the repairs don't get made, where supplementation can help. And supplementation is the phytocannabinoids that mimic the endocannabinoids. CB2 also regulates our white blood cells for infections and is anti-inflammatory, reducing pain by inhibiting cytokines. It also suppresses cancer cell growth and proliferation. Cannabinoids are immune modulators, so think about hitting the gas and hitting the brakes. It can rev us either up or down depending on what's needed to find homeostasis, which is the entire goal of the ECS, is to bring us back to balance. So multiple cannabinoids found in cannabis, hemp, and nutraceuticals like echinacea, beta-caryophyllene, and PEA can all activate CB2 directly.
Okay, so this is a really very engaged slide here, and we're not going to get into details, but this is just an example of high dosing Rick Simpson oil or full extract cannabis oil. A lot of patients will come to us and say, I heard I need to get 60 grams in 90 days. And, and that can be really taxing on the body. This is just an example of how we create. So for someone who wants to get in a full gram of the high THC oil to treat cancer, we do it over 12 weeks. We do it over a little bit longer of a time because we want the body to acclimate. We don't want people having side effects. We want to keep people functioning. And so this is just an example of how we titrate and to teach people to get to that 1 gram if that's what they choose to do.
And it's not all just THC.
No.
Right? A lot of people think, they buy Rick Simpson oil and they take THC oils, and that's not what you need.
You need a balance.
Yeah, concurrent therapies, again, we talked about immunotherapies already, but chemotherapy runs the same way. So think about cannabinoids as potentiators. If it's potentiating the chemotherapy, making it stronger, that could allow for lower chemotherapy dosing, which would lessen the side effects. But if it potentiates these effects, it can also become more toxic to the body, and patients should lower the dose of cannabinoids during chemo days. Same thing if you're using Keytruda and Opdivo. Those are trying to rev up the immune system to inflame things, and high doses of THC and THCA specifically can suppress the immune system. So hold those during the active days. So 25 milligrams or less of THC for comfort dosing is okay. CBD, 100 milligrams for overall wellness support. But having that treatment day plan and non-treatment day plan and working with a clinician can help you. And when somebody gets that beautiful phrase, no evidence of disease, and your post cannabis treatment, cancer treatment acutely, people want to take cannabinoid maintenance because you just want to keep the endocannabinoid system running and keeping things in check. So essentially, we tell people to cut the dosing in half of where you left off for at least the next year. Many people continue taking cannabinoids for many years after treatment. And beta-caryophyllene is something that we're going to talk about next.
So big shout out to Dr. Philip Blair, who's out in the audience today. We are very, very grateful that he was able to create this product called beta-caryophyllene plus. It comes in a tincture and capsules, and this is further details on it. So beta-caryophyllene is a major terpene that's found in the cannabis and hemp plant, but it's also found in various other plants and essential oils with anti-cancer activity. Beta-caryophyllene can be extracted from hops, black pepper, rosemary, cinnamon. Beta-caryophyllene is a prominent component of cannabis and is a phytocannabinoid itself because it activates the CB2 receptors. And here's how beta-caryophyllene helps with cancer care. Induction of apoptosis by intracellular signaling, mitochondrial and DNA disruption, inhibition of angiogenesis, migration, metastasis, pro-inflammatory mediators and nuclear receptors, pro-cancerous proteins, DNA protection and epigenetic changes for normal cells, chemotherapy concentrating, sensitizing toxicity and synergy, modulating cancer receptors, enzymes and transport molecules, particularly CB2 and PPAR receptors, control of cancer cell cycles, inflammation and glutathione, regulation of gut membrane permeability, metabolism in the microbiome. This goes to the eat slide. Modulation of oxidative stress, ROS, redox, and autophagy. Reduction of pain, anxiety, depression, and neurological impairment. And partnering synergistically with CBD and other cannabinoids. And there's a link here that actually goes to our website where there is a beautiful video that Dr. Philip Blair did all about beta-caryophyllene. And you can see the video, and if you're interested, you can get this. And we use a lot of beta-caryophyllene with the patients, cancer patients that we're working with. It can help soften THC. I've seen it help soften THC, and it's often been the missing link for what a lot of patients need that have a hard time going up on the THC to get the results that they're looking for. Beta-caryophyllene has been very beneficial.
Yeah, and it's non-impairing.
Non-impairing.
You don't feel it, you just feel good. And it's actually
and we take it every day.
Yeah. So building your toolkit, and I do say a toolkit because what you're going to want is to mix and match all of these different products at different times during the day and the week. And so many people just start with topicals. These are the lotions, creams, balms, and salves. You can rub it on to sore areas. Onset is relatively quick, duration fairly rapid, just a few hours. So reapply often. Tinctures are the oils or the drops, and this is a sublingual route. Sublingual is under the tongue, and the medicine goes right in. There's a very porous mucous membranes that absorb the cannabinoids right into the bloodstream, so it's also very bioavailable. Onset is 15 to 30 minutes, duration 4 to 6 hours. So you can dose every few hours to keep these cannabinoids in the system. And the other good thing about tinctures, as opposed to the fully extracted cannabis oil, is that the droppers are all calibrated. So it'll have, a specific milligrams, half a milligram, a quarter of a milligram, etc. So it's easy to calculate, as opposed to the fecal oils, which generally come in a 1 gram syringe, and you express a rice grain or a little blob like a pea, and that is going to be a little bit more difficult, but it's allowing for higher milligrams, which is why people would use them. Anything with THC, especially taken by an oral route, you need to have caution, because once it gets into the stomach and starts breaking down, it turns into 11-hydroxy-THC, which feels a lot stronger, and it lasts a long time. So if you're using, somebody takes a gram, and a lot of milligrams, you're going to be out of commission for many, many hours. So inhalation is the other variance. It's something that's very rapid acting, doesn't compete with liver enzymes, so it's something that you can use episodically as you need if you're having nausea or anxiety. So it's a joint, a pipe, a bong, etc. Inhalation generally yields 1 puff is 1 to 2 milligrams. So we always say 1 puff is enough. So pause, assess how you feel. And you can use a dry herb vaporizer, which is ground up flower, and that's going to be your healthiest option. So anything that is cannabis, CBD or THC, you're going to need to shop for it in dispensaries. Hemp is going to be found at online retailers and CBD shops. And again, you can mix and match all of them.
Okay, so we have to talk about side effects, but the side effects are generally dose dependent. And there's the huge biphasic nature, low doses doing one thing, high doses doing something else. So for all of these, so for CBD and THC in particular, pharmaceutical interactions should be monitored with CBD dosing over 100 milligrams a day. Pharmaceutical interactions should be monitored for THC dosing over 20 milligrams a day. When we're looking at the research, and we got this from the Cannabinoids, in regards to CBD and some of the studies, somnolence and sedation was observed in childhood epilepsy studies, high liver enzymes, but they were using high milligrams. And this is something that people generally are not taking, like up to 2,000 milligrams a day. Excluding trials focusing on childhood epilepsy, the only adverse effect was diarrhea. The issue is, the interesting thing about this is none of the parents in these particular studies decided to stop the treatment, because the benefits of the CBD outweighed the side effects. So they were seeing seizure reduction in CBD. So Cannabinoids review clinical evidence suggests that CBD is very well tolerated and presents a very good safety profile. Some experience dry mouth and fatigue. THC, on the other hand, you have to be a little bit more cautious. And so that's why we encourage people to work with a clinician and to balance out THC with CBD. We can see drowsiness, dizziness, vertigo, ataxia, tachycardia, potential risk for falls. Some people may get dry mouth, dysphoria, anxiety, panic, and nausea. This is with high doses. The addiction and withdrawal potential is less than 10%. But I also want to talk about the side effects being the side benefits that some patients are looking for. So for example, the patient that has dry mouth welcomes the dry mouth that has ALS, right? The patient that has glaucoma actually welcomes the red eyes, because it shows the vasodilation and that it decreasing pressure in the eye. The patient that has nausea and cachexia actually welcomes the munchies and the increased appetite. The patient that's hypervigilant and has insomnia actually welcomes the drowsiness and sleepiness. The patient that has PTSD welcomes the forgetfulness. And the patient that's depressed actually welcomes euphoria. Euphoria is not a crime. Dysphoria is in this day and age. Whole plant formulations, microdosing, and working with the cannabis clinician can potentially decrease side effects across the board.
And staying safe involves finding your Goldilocks dosing, or that minimum effective dose, so that you have therapeutic response, but you're not impaired and you don't have side effects. Start low, go slow, especially with THC products, and dose in microdoses. So that's breakfast, lunch, dinner, and bedtime, to just mimic the endocannabinoid signaling that's going off all the time. CBD generally for daytime, THC for evenings. You can use a 1-to-1. That is our CBD THC combo in equal parts as needed. And that is a good workhorse for many people that are struggling with multiple symptoms. Stacking these products, topicals, tinctures, capsules, gummies, and inhalation can keep your tolerance low on any one of them. Safety with pharmaceuticals generally involves spacing, so that we are taking the pharmaceuticals first, then having lots of food and water to flush things through, and then taking your cannabinoids an hour or so after that. And this really has to do with oral dosing. Inhalation can be any time because it's not going through the liver per se. We always ask people to journal, track the results, and talk to their providers, and be very open with this, because as you've learned, cannabinoids can interact.
So now we're going to do some case studies and this is how we work with patients. You know, we work at patient-centered care. What does the research say? What does the patient want? We look at real world evidence, the judgment of the clinician, results from trials or observational work. So we're going to go over some case studies now into detail.
So estrogen positive breast cancer study. This is a 58-year-old woman who was receiving chemotherapy and radiation, had nausea, appetite loss, insomnia, fatigue, and a lot of pain. She started with some full spectrum CBD through soft gels twice a day, morning and evening, which helped her mood, inflammation, and her resilience. Added THC in the evening for appetite, nausea, deeper sleep. And she did have a 1-to-1 THC CBD vape pen for fast relief. She also was able to fold in some raw cannabinoids, CBDA, and also added some CBG. And in 4 months, she was eating better. Her weight was stable. She had an improved mood, less pain. She was sleeping well each night and tolerated the chemo and the radiation better, expressing more optimism. And this is really how we like to work with people and giving them that better day.
And this is a 52-year-old woman that had triple negative breast cancer subtype, post-lumpectomy. She was doing chemotherapy and immunotherapy. So she did have 2 different care plans, you know, those for chemotherapy, immunotherapy days, and then a care plan for non-treatment days. And so her symptoms at the time were pain, anxiety, insomnia, and loss of appetite. She did opt to do the full extract cannabis oil. We got her up to 350 milligrams a day of THC. She was doing 4 doses a day, and this promoted apoptosis, reduced angiogenesis, helped with her appetite and pain relief. She was also doing full spectrum CBD up to 200 milligrams a day in divided doses. This was for her mood, for inflammation, and it actually buffered the THC psychoactivity. It helped her to be able to tolerate it so she wasn't impaired. She did CBG 100 milligrams a day in the morning for energy, focus, and endocannabinoid system support. She folded in some of the minor cannabinoids, the acidic version, CBDA and THC for anti-inflammatory. And she also used beta-caryophyllene and genuine ECACT to support her journey. And her results after 6 months, her appetite and sleep were better. She cut her opioids, her chemo and immunotherapy was easier. No new lesions. Cannabis gave her strength and control during aggressive treatment, helping her to thrive rather than just survive.
It's the key of the game. So some protocols might include full spectrum CBD in various milligrams, some adding high dose THC, and that is going to be custom dosing. As you've seen in the previous slides, it can vary from 20 milligrams to 200 milligrams, low to moderate THC on general treatment, and then treatment days when you're using chemotherapy and immunotherapy. Minor cannabinoids, if you can find them, fold those in. Balanced formulations, 1-to-1 CBD THC, again, is our workhorse, really helps overall the best. Other supporting supplements, beta-caryophyllene, genuine ECACT, can't say enough about that. It really helps cleanse the body and the entire digestive system. High-dose melatonin also seems to be very beneficial. And timing to maximize function and lifestyle. And then adding in whole foods nutrition, movement, meditation, mind, body, and holistic psychosocial support to enhance connection and love.
Yeah, so supporting the endocannabinoid system. So, we see people in crisis, struggling, surviving, and healing isn't the absence of illness or disease. Truly, it's about doing the best you can in any given moment. And so supporting the endocannabinoid system is multifactorial. And you can see we've got cannabis and hemp products at the very bottom of the list. Oftentimes patients will come to me and they'll say, gosh, Sherry, I'm eating whole foods. I am meditating. I am, doing massage, I'm going to the chiropractor, I'm doing essential oils, I'm doing energy healing, I'm chanting, I'm not drinking, I'm not smoking, and nothing's working. And so I tell them, give these things a chance. Once you introduce plant phytocannabinoids into your diet, re-explore some of these other healing modalities. There is research to substantiate that they do influence the endocannabinoid system and support it for healing. And this actually supports the relaxation response. And so think about it. When we're in the relaxation response, this cultivates an opportunity for the body to heal.
Yeah, and the endocannabinoid system really is that important. I like to say it's like the one ring to ring them all. It really ties everything together, and things really do start working. So last up, safe shopping. We ask you to use Green Nurse approved types of medicines. Cannabis CBD, again, is going to be found in the dispensaries. It's 0.3% or more THC. Hemp CBD is 0.3% or less. And there's isolate, broad spectrum, full spectrum. 1-to-1 is in the dispensaries. Make sure you're doing business with companies that are transparent, have good manufacturing practices, organic, lab testing. Certificate of analysis is very important. That testifies to the potency, and potency serving sizes can vary. A bottle could be 300 milligrams or 3,000 milligrams, and so that dropper could be 10 milligrams or 100 milligrams. And that's really going to make a difference on how it plays in the body. So call the free nurse line 970-404-HOPE 4673 for questions, and let us know how we can help.
And so Bloom Hemp CBD, what makes us a little bit different? We're woman and nurse owned, USDA organic hemp CBD, doctor and nurse formulated, Ayurvedic inspired products, symptom targeted formulas coming with a free nurse line, free emailed care plans, and a free network to dial it all in. So on the left, you can see the QR code there. You can scan for a free emailed care plan, and we will respond back within 24 to 48 hours with dosing recommendations and products from the Bloom Hemp suite. And then if you just wanted to explore the shop, you can go right into the shop with this other QR code on the right, Bloom Hemp CBD, and use Green Nurse for 10% off and free shipping.
Yep. And the Green Nurses at the Cancer Playbook, you can scan these sites and learn more about the Whole Health Oncology Institute. We are working with them as the nurses, assisting patients on managing whole health through the Cancer Playbook. And so essentially you can create your own playbook, which is going to give you weekly check-ins. You're exchanging data for all kinds of support systems. And we are very proud to be part of this because it's really important in spreading the news.
And again, Ask the Green Nurse. So we have a blog. And if you have questions, you can email us at info@bloomhemp.com or info@holisticcaring.com. And I will reply to your email with my answer to your question. And I may choose your question to write about. So I've been writing a lot about how quick questions that patients ask us all the time. I have a blog on Substack. We're now also on the Kenigma, where you can read some of the things that we are writing about.
And I'm very proud to see the Green Nurse syndicated. We've been working hard on this for many years, and it's finally here. So fast forward, you can download your free medical cannabis guide. This is a 7-page guide where you can learn all kinds of things to dial in, and it is here. Just scan that QR code right now. It'll take you right to where you can subscribe to our newsletter, which then will trigger the download right now to your computer, your phone, your tablet, etc. And then join our ecosystem at Holistic Caring and the Green Nurse. This provides the structure for all of the products and services that we offer, and you can scan that, go right into the network. We hope to see you there. We have a free patients plant medicine support group. We have free programs, ABCs of CBD, Introduction to Cannabis, a free patient portal so that you can connect and chat with peers. And it's lovely to see that. And then all of our paid programs are also housed there, where we do professional training and mentoring. So with that,
I think we do have one other poll.
do we have another poll?
Yeah. So the last poll is, are you more open to using cannabis and hemp CBD for breast cancer? So I'm going to just put that poll in.
Okay. So if you were hesitant to use CBD and cannabis for treatment and managing symptoms, would you be more inclined to do so after listening to this webcast?
All right. We got almost someone's still deciding. Okay. We got, well, I'll publish the results.
Most are a yes.
Most are a yes.
Well, good for you. So what other questions do we have?
I do have some questions.
Okay.
Will we have access to these slides after the presentation? So after the presentation, within an hour, we're going to be sending an email with the Eat, Sleep, Relax, Forget, Protect, and some resources that you will be able to get. You will also get a replay of this video. We are not sharing these slides because these slides are actually part of a bigger program that we're going to be launching in the next week.
Yep.
And we're going to be launching this on the Holistic Caring website, going into more detail. Currently, this was a 60-minute presentation. We're going to be doing this presentation again as a program that we sell on our website that's going to be about 2 hours long.
Well, yeah, it'll be about 90 minutes. And it also includes 2 hours of continuing education for registered nurses for them to use on their license certification. And it also is going to include some history and some other types of, let me stop sharing. History and other things that you're going to want to learn about cannabis.
Yeah.
So,
but this, you will get a replay of this video that you can watch. So if you want to take screenshots while you're watching it, you can. This will also be on our YouTube channel at some point in time, that you'll be able to watch it as well. And then there was a next, not clear what the following are: CBG, THCV, CBN, CBDA, and CBGA. These are all minor cannabinoids, and they all have a therapeutic potential. So if you go to holisticcaring.com, we have an educational tab that has a drop down on it.
It's called Learn. It's the Learn tab.
The Learn tab. And then the Learn tab, we have information on the endocannabinoid system, information on cannabinoids, the major ones, the minor ones, terpenes, botanicals, going into detail as to how they work.
As well as conditions.
Right, free, right on our website. So you'll be able to understand more deeply how these work.
And just shorthand here, they each have a different pharmacological action. So CBG is going to hit these receptors a little differently than THC, differently than CBD. And so when they all blend together with the entourage effect, that is like pulling in the entire orchestra and blanketing the body in healing potential. And so sometimes you're going to want to use them targeted and isolated, and sometimes you're going to want to use them all together in whole plant medicine.
Yep. And then someone said, what is the best next step? I'm interested. Okay, so the next best step, if you're interested, if you would like to get a free emailed care plan, I would start off with Bloom Hemp CBD. If we go back, we want to pull up the slide. I don't know if we can.
Back to the,
yeah.
Let me go back to.
It was going to pull it right up. So if you go to bloomhemp.com, and on bloomhemp.com, there is a service tab. At the service tab, we have an intake form that you would fill out, and we could send you and do a free emailed care plan. If you wanted something, a one-on-one consultation deep dive with us, that's on our other site, and that's a paid for consultation. So we offer free emailed care plans on Bloom Hemp, and then we also offer paid consultations on Holistic Caring.
So if you scan this one on the right corner, you'll go straight to holisticcaring.com, click the patient tab, and you'll see consultations. And a consultation where we sit down and have a good hour-plus conversation with you on the front end. And then we have conversations with you throughout the month by text, by phone, email, etc. That's only $250. If you want us to talk to your physicians or your family, that's all included. So there's a lot of value in there. Or you can just go this route and fill out the intake form for a free email care plan where we'll give you some product recommendations and some tips.
Yep. And that's the end of the questions. So
Alrighty.
Thank you all for joining us. And I always like to end our sessions with, remember what it's truly all about. It's all about living your best life and helping others do the same.
So thank you, and God bless. And we hope you've enjoyed this presentation for Breast Cancer Awareness Month. Good night.